June is International Men's Health Awareness Month. We're highlighting some illnesses that affect men. Among the top 5 are heart disease and prostate cancer. Urologist Dr. Preena Sivsankar joins me now in studio to talk about this and other health issues. Doctor, very good morning. Thank you so much coming through this morning. Let's talk about the first establish the top 5 health issues facing men in South Africa at the present moment.
So definitely heart disease, cardiac disease, diabetes, and then cancers like prostate cancer, testicular cancers. Those are some of the most challenging issues with men currently. And we unfortunately are having an increased number of men in the third world that are now developing these problems. And a large amount of them can actually be prevented.
One of those things is, besides prevention, is early detection, isn't it? Which means you have to go for those checkups all the time. And I'm in that particular category where you start worrying about prostate cancer, heart disease, and so forth. But there's a bit of stoicism that creeps in as a man. You know, you're like, oh no, I'll wait until I feel that pain, which is a problem, isn't it?
Yes, definitely. Prostate cancer will not give you symptoms until much later, once it's spread out of the prostate and it's become metastatic disease. So screening, doing a blood test and seeing either your house doctor, your urologist to do a rectal examination, those are the best ways to detect prostate cancer early.
And what do you recommend that men should go in for those checkups at least once every single year? And what sort of age groups are we talking about here as well?
So we're looking at age groups between 40 and 45. That's when you should be starting, especially if you have a family history of prostate cancer or other cancers within the family. So those are the ages that you should be going in to have a checkup, and once a year.
Okay, let's go to the prevention side. What do you do when we... Okay, prostate cancer might be a difficult one to focus on, but what sort of prevention, you know, can a man... Is it a diet issue? Is it exercise? What do we do?
So 90% of the cancers that I see, that the heart disease that I see, can be prevented with dietary changes. And we've seen an increasing trend amongst the wealthy and very influential people of changing their diets to plant-based diets. Beyonce Knowles, Jay-Z, Lewis Hamilton, James Cameron.
They can afford all of those guys. Men you've just mentioned can afford to do all of that lovely stuff.
They can afford the best medical care, but they want to prevent these diseases. And plant-based diets are very cheap. They can be very cheap if you support your local farmers, if you grow your own vegetables, and we're quite fortunate about that in South Africa. Dairy products are a prime concern with prostate cancer. If you consume a large amount of dairy products between the ages of 14 and 17, you have a 3-fold increase in prostate cancer. So this starts in teenage years. So the moms who are feeding their kids yogurt and cheese, not a good idea. The chances of your children having prostate cancer is 3-fold if they consume dairy on a regular basis. So stay away from dairy. Even men with prostate cancer develop more aggressive prostate cancer if they consume dairy products.
Doc, you're depressing me. I'm going home and taking out all the dairy products in my
eggs
fridge.
As well. If you have 2.5 eggs a week, you have an 81% increased chance of having a lethal prostate cancer. So that's a prostate cancer that you can die from. An app that I use for my patients, because that's the first question they will ask me: how can I prevent disease? How can I prevent my cancer from becoming more aggressive? It's Dr. Gregor's Daily Dozen app. It's a free app that you get from the App Store, and you need to go according to that list, and you will prevent 90% of heart disease and cancers.
Talk to us about exercise. How much exercise does a man need every month or every day?
So diet is 90% of the solution. 10% is exercise. So 30 minutes, 3 to 5 times a week is good enough. And that includes helping your wife at home with household chores, mowing the lawn, playing with the kids.
Do all of those things.
But you can play with your son, soccer, all of those things. Exercise doesn't mean going to the gym and sweating there in tights. It's all these little things, taking the stairs at work.
Okay, 100%. The other issues here that we need to talk about, you've got diabetes as well. Binge drinking is something that's becoming a major problem. Talk to us about binge drinking and why it's a problem.
So I sometimes get men and I ask them, how much of alcohol do you consume? They're like, just on the weekends. And you're like, how much alcohol are you consuming on the weekends? They're like, a bottle of whiskey or 10 beers. The problem with that is that it hits your liver hard and it hits it fast. You will get a drop in testosterone level, and that's when you start getting man boobs and the beer belly. And then the next problem is erectile dysfunction associated with that binge drinking, and also diabetes and heart disease.
Okay, so binge drinking is a no-no. Depression and suicide as well. Those become, that's a health problem, isn't it? And affecting a lot of men, especially depression, especially during economic hard times.
Definitely. And, you know, depression affects the whole family. If you've got one member of the family, especially the head of the household, whether that's the wife or the husband being depressed, it affects everyone in that family. So your overall well-being, exercise will reduce your chances of being diabetic. A plant-based diet is going to reduce your chances of depression. And you know, holistic approach, chatting and speaking to your religious or cultural leaders. If you are having problems, if you are having stress, that is very important. Okay,
so change your diet, look at your diet, also exercise. I'm going to take every single thing you've said and try and do that for myself, Doctor. Dr. Preena Sivsankar there joining us in studio. Talk, of course, is International Men's Health Awareness Month.